NirogStreet वीडियो सीरीज। आज हम बात कर रहे हैं नी पेन के बारे में। आज हम हैं डॉक्टर गीता कृष्ण जी के साथ, जो कि है हेड इंटीग्रेटिव मेडिसिन मेदांता के। सर वेलकम टू सीरीज। सर नी पेन एक्चुअली है क्या, क्यों होता है नी पेन?
Knee pain can be a result of many diseases or conditions. It can also be a condition. Most common cause of knee pain is because of some kind of an injury or some kind of a inflammation. Inflammation is surgeon. It can happen because there is a like knee is one of the strongest like joints in our body, and it carries the entire weight of the body. Every time we put a foot forward or backward or climb a stair or climb down a stair, we are actually putting a lot of pressure on the knee. And sometimes what happens is there is a cushion between the thigh bone and the bone below the knee, which is called as tibia and femur. There's a cushion of cartilage, which is the the fluffy kind of bone which is formed in between the bones, so that it's given some kind of a cushion. Sometimes it wears off, and small wear and tear will happen in this cushion, and when wear and tear happens, it will become inflamed, because it's quite natural. Any kind of injury to any of these small these organs can cause an inflammation. That can be one reason for like knee joint pain. There are many ligaments, or like connecting tissues within the joint. It's a very complex joint, so one of the ligaments can get broken. That can be another reason for knee joint pain. There could be like there are these cushions which I told you about. The cartilage cushions are in a particular shape, C shaped or crescent shape. Sometimes it actually tears off. That can be another point of knee joint pain. Sometimes what happens is like due to old age, the bone density, the strength of the bone reduces, and due to old age, there is some liquid within this the joint called a synovial fluid that reduces in quantity. The formation of that reduces in quantity. Then the bone starts coming together to each other, and then the bone starts getting lot of like disturbances in it. Then what happens, this bone starts touching each other whenever you make a movement, and when the bones touch each other, it causes pain. Again, that's another cause of knee joint pain. Sometimes what happens is there is a bony projection within the joint itself, which is in the lower bone, which is called as tibia. Sometimes this bony projection starts growing up, and it like a suji, it starts hitting the upper bone. Then you get another kind of knee joint pain. So there are like different reasons for knee joint pain. It can also be a part of an inflammatory process, like you have a rheumatic disease, and then it can cause knee joint. Probably somebody had a fracture and had been like put on sling, and without moving the knee joint for more than 3 months. Then this knee starts getting set together in that particular fashion, and it doesn't move anymore. Then you have another kind of reason for having knee joint pain. So knee joint pains are the reasons can be of umpteen number, but finally at the end of the day, patient who suffer from knee joint pain suffers from knee joint pain and cannot walk. So mostly we see this in old age patients, like patients who are
Above 40?
above the age of 50, like, and more in women, because they're because of their like hormonal changes in the body after the age of 50. They have a higher reasons for losing calcium from the body, and then the bones like strength reduces and the bone starts coming together. So that can be another reason why knee joint pain happens for many patients. So uh, like whatever may be the reason, there we can coin down to two or three simple like general reasons for knee joint pain. One is degenerative, which usually happens in old age. Another one is due to injury, which could be because you are like you have been doing playing tennis, or you have been walking, or something hit you, etc. Or some otherwise it can be an inflammatory disease like a rheumatoid arthritis. So there are three major divisions in identifying why a knee joint pain happens to you.
So when should a person consult a doctor?
The moment you have knee joint pain, because you need to understand why you are having knee joint pain. If it is definitely associated with inflammation, then you should 100% see a doctor, because knee joints are very important joints in the body, and like any difficulty in the knee joint pain can hurt you throughout your life. So like you cannot move around properly. You have a limb. It doesn't look nice. So not only look nice, you cannot climb your stairs for 2 stories. You have a big problem in your hand. And as you grow old, your other parts of the body will also become weak, so you cannot carry yourself. So knee should be kept in quite good health. And the moment you have any kind of knee joint pain, you should meet a doctor. And probably the doctor might advise you to go for an X-ray, or they might examine the knee and see whether there are any inflammation, there are any ports which is causing pain. They will try to turn the knee and see if there is something which is happening inside which is causing the pain. They will look for like temperature of the knee, etc. But you should see a doctor. That's very important. Anybody with a knee joint pain should see a doctor.
So, for example, a person is suffering from knee pain. What precautions he should take so that the pain.
Depending upon the type of knee joint pain, the precautions also vary. For example, if you have an inflammatory disease where you have had knee joint, you should be very careful in movement, etc. Because it can, but you should move at the same time. But you should be careful in your movements. That's very important. You should not move too much. You should not put too much stress on the knee, etc. Let us say it is due to injury. Something had hit your knee and there is a fracture or there is a bleeding within the knee. You should be very careful. You should not move. You should be, movement can cause problem over there. Whereas you look at other situation where you have osteoarthritis, where there is a degenerative knee, you should move, but in a not as like careful as when you had an inflammatory joint disease. But you should try to keep your regular lifestyle, because that is a whole thing. In degenerative knee joint pain usually happens to people who are old age, and they come to a doctor not because they have knee joint pain. They come to their doctor and say that I cannot do my regular work. So if you are saying that, okay, now you sit in a corner and you don't have to do your regular work, that doesn't serve the purpose. So when you so the three different varieties of knee joint pain in general have three different approaches to the precautions. I said this.
So yeah. For example, any older person is suffering from knee joint. What can he do to take care of the joint at home?
Okay, what we do here is we do teach patients how to take care of it at home. We don't regularly ask them to come to a treatment or therapy. But some therapy is required. Like one is oil application is very important. But when to apply oil is also important. So you cannot straight away start applying any oil and find benefit. So there are advertisements and all those things running around in newspaper and TV and probably radio also saying that you take this oil and it will help you to take care of your knee joint. And that happens to a small number of people because they have already reached that stage where they can apply oil. You need to prepare your knee to accept oil. That is very important. And Ayurveda has ways of doing it. There are some internal medicines which we give and some external therapies which we do, which are all simple. We can do it at home. Like so, we ask patients to take a potli, which is a herbal bag, and then apply it in a particular manner in the knee joint. And we also ask them to once they reach a particular stage of symptoms, we ask them to shift to oil therapy. Like, but on a regular basis, once you're old age person and you have started developing osteoarthritis based knee joint, you should think that you have added one more daily routine to your life, which is going to be a 15-minute time given to both your knees. Like you give 3 minutes to your brush every day at least, or 15 minutes to comb your hair. That's a different thing. But you should find time and give 15 minutes to your knee, so that if you give that 15 minutes, you'll be able to function with your knee without any problem for a long period of time. Many of the patients who undergo knee joint replacement does not require knee joint replacement. Then just they might be getting a knee joint replaced at the time when they require it. But if we identify them early, we will be able to prevent them from them reaching the stage of knee joint replacement. So somebody who has mild knee joint pain and mild degenerative changes, when he meets a doctor, if the doctor says that, okay, now you come back after 2 years when your knee has become completely, खराब हो गया उस समय आ जाना ऐसे बता के like if the patient goes home saying that, okay, I am just waiting for my knee to be bad so that I can get a replacement, is not the right approach. The right approach is to see how much you can prevent it from degenerating. If it is an early phase of degeneration, we can reverse it. It is not that it is your body. It is not a it's not a vehicle part which you think that okay, now खराब हो गया तो ठीक नहीं होगा. Your body has always been, getting degenerated. It has always been regrowing. So only thing is that we need to make small changes here and there so that it starts regrowing better. I hope you understand that. So a patient who has knee joint pain, who has the age of around 50 or so, should immediately see an Ayurvedic doctor. I will say you should see an Ayurvedic doctor. You should find out what stage of degeneration their knee is, and then you should take a therapy immediately for a short period of time from the doctor and some medications, and then regularly do the practice of therapies at home, which will definitely reduce the pain, keep the pain at bay, no pain at all, and you doing all your work as is normal, and then going on with a healthy knee for throughout your life. That's possible. So the most important message which we should give is that if you have knee joint pain and if you are above the age of 50 and if you are a woman, immediately see an Ayurvedic doctor and get the right approach and right treatment, which is not expensive, which you can do at home, which is very simple, and the medicine itself is almost zero cost, like considering the cost of other medications, but you should regularly apply. It is like brushing your teeth, like as simple as that. So we should make it a habit, and people should understand that they should go for an Ayurvedic doctor in case of early situations of knee joint osteoarthritis.
So, according to Ayurveda, are there any kind of asanas or yoga that a person who is suffering from knee pain can do?
Most of the asanas and in yoga, a patient with suffering from knee joint pain can do, but only few of the knee joint, few of the asanas which a patient should not do would be those which will bring extreme stress to the knee joint. Like let us say Vajrasana, where you bend your knee quite a lot and sit on the heels, which is not a good thing to do. Whereas like most of the asanas can be modified according to the person's requirement to so that he will be able to do almost all asanas. Only thing is that those asanas which will put extreme stress on the knee, which should be avoided. All pranayams can be done with anybody who has knee joint pain.
So, is knee pain chronic? Can it be cured at some point of time in life? Like
Depends upon,
completely?
again, that depends upon at what point in the progression of the disease that you approach an Ayurvedic doctor. If it is an early progress, the chances of complete recovery is more than 90%. Complete recovery. Like if it is very late and your knees are not at all moving, and then you come to a doctor, then you can manage your pain. You can reduce your pain by, if your pain is at the from a 0 to 10 level, it is at around 9 or 10, you can reduce it to 3 or 4, but still you will have pain. But that's only the quantum of pain that you are reducing. If you are early enough, you will be able to prevent the disease and reverse the disease itself.
So, are there any kind of tips for the people who are suffering from knee pain at home? What can they do?
One of the first things that I would suggest is that they should not stand for long period, and even if they walk, they should give regular intervals of rest to the knee joint. They should apply oil on the knee on a regular
So,
basis.
what kind of oil should they
If
should
they are not
use?
seeing an Ayurvedic doctor, they can start with tilka tel. Simple, start with tilka tel. Apply application of oil. If you are not diabetic, you can start taking til and good. If you are not diabetic, til and good internally. So what you have to do is you have to take black till and then dry fry that, and 1 teaspoon of till and a little bit of good. You can take it like chew it in, and it's quite tasty. So you can start taking it like that. Actually gives the bone, then improves the bone formation, especially of the large bones in the body. So that's something which they can do. They can also start taking turmeric with milk if it is an inflammatory joint pain. For example, there is सूजन, knee joint में अगर सूजन है, then they should start हल्दी 1 teaspoon लेना है, गर्म दूध लेना है, और उसको हल्दी को उसके साथ मिक्स करना. When it should be warm enough to drink, drinkable warm milk में इसको मिक्स करना. पाउडर्ड हल्दी, नॉट कच्चा हल्दी. पाउडर्ड हल्दी 1 teaspoon मिक्स करके एक पिंच ऑफ ब्लैक पेपर इसमें ऐड करके इसको लेना in the
So,
night.
right.
Yeah, night. That's how it should. And preferably, if somebody has knee joint pain, try to like prevent exposure to like moving air. Like putting your leg exposed to fan can increase the pain. You can try that. And anybody who has knee joint pain can try to expose their knee joint to the fan. But in the night, especially in Delhi summer, you will feel quite good by exposing the leg but by the next day morning you will have more pain in the knee. So it's better to cover the knee. You can put on the fan. There's nobody stopping you from putting on the fan or sitting in the AC or anything. But too much of moving air or striking on the skin of the leg is not good for you.
So there are a lot of kneecaps available in the market. Are they beneficial for knee pain?
If you are going to stress your knee quite a lot, the kneecaps are good. For example, you are a tennis player, you are a shuttle badminton player, you have a habit, already have a knee joint injury, and you are walking, you have to walk for a long distance. The kneecaps are good because it supports it. But otherwise, if a normal individual starts wearing knee cap and starts walking, it's not good because they're actually instead of the muscles getting strong, you are actually supporting it externally, and the muscles do not get strong. So that's not good. So some kind of a stress and strain on the knee joint is good because then the muscles will become strong. But if you have an already existing problem and you are supposed to do more and more, like of the same thing which had caused the pain to you, then it is better to have a knee cap, especially for those people who are using their knee on like in a stressful manner, like like what people are saying is that like you wearing a tight jeans will cause a pain in the knee, etc., etc. It could be in one way true because like when you put a tight jeans and then you start walking, if it is not a stretchable jeans, then it will actually hold some muscles here and there, etc., etc., and it can cause pain. But it is not a direct implication that in every tight jeans will lead to knee joint pain. It can cause considerable discomfort to you by wearing. Anybody will not feel comfortable wearing a tight jeans and walking around. But it is not directly something connected to knee joint pain, but it can cause knee joint pain of over a long period of time because your muscles will start getting pulled here and there, and which can later lead to like small changes in your gait. Because if some muscles are pulling, you will feel mild pain, so you will overcome that. You will walk in some other manner which is not natural to you, which can lead to changes in your structure of walking, and then it can lead to knee joint pain. So it's a long circuitous route which could lead to knee joint pain. But it is better to wear comfortable clothes rather than to like wear very very tight clothes. There are other reasons also why people should not wear tight clothes because it can lead to impediments of blood flows, and like your internal organs can get less blood flow, and there are other things which can happen, but not immediately knee joint.
So thank you so much for this vital advice. I'm sure our viewers will be benefited by it. Thank you so much. Um, for more such videos, please like, share, and subscribe our channel. And stay Nirog, stay healthy. Thank you.